Welcome, Nadine. Thank you so much for joining us for Social Sciences Week and delivering a presentation on equine assisted therapy. For those that want to learn more about Nadine and her crew, go over to Nature-Based Therapies for tons of training opportunities and ways to engage in Nature-Based Therapies Australia. And with that in mind, Nadine, I'm going to pass over to you.
Thank you.
Thanks so much.
Welcome. Welcome everyone. I can't see you all, so hi to everyone that I may have met and those I haven't. Today I'm going to share a little bit about the foundational parts and components of equine assisted therapy and how we apply that in a mental health setting, and a little bit beyond that as well. So a little bit of an outline of what we're going to cover this morning. We'll do a conceptualization of equine assisted therapy, talk a little bit about terminology. We'll go through some common applications, touch a little bit on the evidence and research base. I'll share a little bit about the benefits and how this approach to supporting clients can increase accessibility. We'll talk a little bit about the challenges. I'll share a little case study of mine, which involves equine assisted EMDR, and then there'll be time at the end for questions. So if anyone has questions along the way, please feel really welcome to pop them in the chat, and we'll catch up with those at the end. So a little bit about me. This is me with two of my ponies. I have been a social worker for a couple of decades, but I started out in statutory child protection and then a non-govy in out-of-home care. And then about 10 years ago, I discovered this really cool thing called equine assisted psychotherapy. I've been a horse person all my life, so this really made sense to me to bring together nature and horses and helping people. So I feel very privileged that I can offer therapy in this sort of way. I studied equine assisted psychotherapy and opened my private practice, which is called Hunter Valley Children's Therapies, which is in New South Wales in Australia for those who are overseas. And I have a few practitioners who work alongside me at our farm. We have about 30 acres here and a bunch of horses and dogs and cats and all the other animals in nature, kangaroos and things, which is very cool. And the other hat I wear is as a co-founder of Nature-Based Therapies, and we offer training and consultation and supervision for those interested and working in the space of nature-based and animal-assisted therapy. So I'll just kick off with some information about the terminology, because this has caused a lot of challenges in the sector. And in 2024, a paper was published to help try and clarify this, and it was called Recommendations for Uniform Terminology in Animal-Assisted Services. So it was authored by a group of international experts in the field, and it aimed to address the inconsistent terminology and definitions in the sector. So this inconsistency has caused difficulties for the delineation of roles of service providers, for the recipients of services at times, and as well for the preparation, training and expectations of the animals that are involved in the work. So it can be argued that these difficulties have compromised the development of the field in terms of establishing agreed standard of practice, qualifications and competencies, and adopting good animal welfare practices. It's also likely limited the base of evidence, as search terms used across studies are not consistent, and study protocols are difficult to compare because of the lack of uniformity in the terminology. So additionally, the current terminology wasn't able to accommodate the expansion and diversification in the programs that were being offered around the globe, really. So there's been a proposed umbrella term of animal-assisted services, and this is defined as services that are facilitated, guided, or mediated by a health or human service provider or educator who works with and maintains the welfare of specially qualifying animals to provide therapeutic, educational, supportive processes aimed at enhancing the wellbeing of humans. I've got a resource list at the end, so if you want to read more on that paper, you can access it through there. So Animal assisted services are then further categorised into three main areas. So you might often hear people refer to EAP, or equine assisted psychotherapy. And the paper talks about moving that over to be more clarifying, calling it equine assisted psychotherapy and equine assisted treatment. So that means that the treatment, that the service is focused on treatment for people, and it's provided by a professional, so a social worker, psychologist, counsellor, OT, speechy, those sorts of things. And that's different to equine assisted learning or equine assisted activities, and that's more educational in nature. So that might focus around social and emotional learning, personal development, psychoeducation, therapeutic. Horse riding falls under that category as well, farm care programs and prison-based programs. And then there's a third arm to that, which is animal assisted support programs. So that might look like animal assisted crisis support, reading programs alongside animals, courthouse dog support, and animal assisted services in schools. So common application, pretty much anyone. So we can offer this service across the lifespan in the space of mental health treatment, trauma recovery, and disability support. That's my crew of co-facilitators, I think we would refer to them as. Yeah, my team. So I often get asked about what a session might look like. Like, what do we do? It's more than just patting a pony. It's facilitated by a therapist who's offering treatment, and this might involve something like observing the herd and how they interact with each other, how they regulate their nervous system. It might involve like a relatively standard session that might look like a room-based session, but we're outdoors in nature and horses are around us. It might involve touching and grooming, leading horses, some play-based interactions. I work with children, so there's lots of play-based interactions that happen. And we do also offer mounted experiences. So just to clarify on that, that's quite different to horse riding. We don't teach our clients how to ride horses, but they may be sitting on a horse and being led, and there would be a very clear and intentional reason why we're offering that experience for someone. So there's a few key parts to all of that. So sessions are, as trauma-informed practitioners, sessions and opportunities alongside horses are always invitational, and this promotes agency and control for our clients. We take an experiential approach, so we're co-creating an experience and that we walk through together with the client, and this is happening in real time. So the clients are able to attend then to all the emotions and interactions and responses that happen in the present moment. There's also a really important component to offering this work is that it's mutually beneficial for both the client and the horse or the animal that's involved. So the welfare of that animal is equally as important as the welfare of the client. And the practitioner will always consider how any offer might benefit the client and the horse. So this keeps everyone safe then. So there have been some challenges around the evidence base for equine-assisted interventions. So in 2019, there was an umbrella review undertaken to kind of look at all the evidence that was available at that time, and that of the 19 systemic reviews considered eligible for inclusion in that study, 13 were included, and 79, and this covers 79 individual studies of equine-assisted interventions, mainly focused around hippotherapy and therapeutic riding, which is slightly different to, or a lot different, sorry, to equine-assisted psychotherapy. So the studies were a little skewed. So at that time, they discovered that there were multiple methodological, I can't even say that word, weaknesses and extensive variations in terminology, hence the need to get us all on track with saying the same thing, and the application of a variety of different therapeutic approaches and models. So They concluded that therapeutic interventions that included a horse couldn't at that time be counted as best practice, and they recommended that further research is undertaken. So that was 7 years ago now, and there's a growing body of research pointing in the direction of efficacy as improvements have been made in the sector towards uniform terminology about what animal-assisted services are, and therefore research can then be more targeted towards specific models and how they're provided. So we're also seeing improvements in the quality of the research that is coming out. There's more clarity about what the intervention is, who it's being offered to, why the animals are being included, because that's an important part to consider as a clinician, and how these services are being offered to clients. So having said all of that, and with all of those challenges in mind, as a social worker, I'm still well within my scope of practice to offer an evidence-based therapeutic model that I might have been trained in alongside horses, with consideration to the fact that is that going to be the best approach for that particular client. So there are some theoretical underpinnings that go alongside offering equine and animal-assisted treatment. So biophilia is the idea that humans have an innate tendency to seek connection with nature and other forms of life. This idea was introduced in 1984 by Wilson, and he suggested that because humans evolve in close contact with natural environments and have done so for millions of years, our brains are hardwired to find living systems. So that's plants and animals and landscapes. So he suggested that we are all innately connected to living systems, and this attraction isn't just a cultural basis, but rooted in our biology. So he also found that we have an affection for nature that may have helped early humans survive. So, for example, we prefer landscapes that have water and trees and open views, which offer food and safety. Research also shows that exposure to nature can improve our mental health, reduce stress, enhance creativity, and foster pro-environmental behaviours. We also lean on attention restoration theory. So this came about in the 80s and 90s, and it explains how spending time in nature, in natural environments, can restore our ability to focus and reduce mental fatigue. Nature helps restore our attention because we're engaging our mind in a more gentle and effortless way rather than demanding a focused attention. So there's lots of cool stuff to look at. So that much gives us a bit of dopamine too, right? We also utilise attachment theory, so that explains how humans form relationship. It was originally focused on infant and caregiver relationships, but it's since been applied more broadly. So in equine-assisted treatment, for example, horses can serve as the attachment figure or attachment substitutes. So especially for individuals who struggle with human relationships, providing that opportunity for a safe relationship and a secure base can help clients experience, practice, and then rebuild those healthy relational patterns. We also utilise polyvagal theory. That's, for those who don't know, Stephen Porges was the founder of that, and he talks about the autonomic nervous system, regulates stress and safety and social connection. So he kind of defines three main states. So we've got our ventral vagal state, which is our calm, connected, open to relationships way of being. The sympathetic state, which is our fight, flight, survival responses. And then a dorsal vagal state, which is our shutdown and sort of freeze response. So polyvagal theory in equine-assisted treatment highlights how horses act as co-regulators for the nervous system. So we can help clients shift from states of into states of safety and calm and connection, and all of that's essential for healing and growth. The other one is the adaptive information processing model. So this is founded in EMDR therapy and developed by Shapiro, but it suggests that the brain naturally moves towards healing and integration. However, when we experience traumatic and overwhelming experience, we can get stuck in a dysfunctional memory network. So These unprocessed memories then continue to trigger distress because they're stored with the original, alongside the original emotion and body sensation and the beliefs that happen at that time. So therapy aims to activate and reprocess those memories so they can be better integrated into a more adaptive memory network, which then reduces the symptoms and restores balance. So horses can support that, and I'm going to talk a little bit about this in my case study a bit later, but horses can then help us by creating conditions that are conducive to processing by creating a sense of safety and trust and resilience, which then strengthens the brain's ability to process and integrate those memories. We offer dual attention stimulus. So in EMDR, we use what we call bilateral stimulation. So that might be eye movements or tapping on our body, moving our body, things like that. Sounds as well. And that helps the brain process stuck memories. So interactions with horses, such as rhythmic grooming, walking alongside a horse or mounted experience, can provide that natural bilateral stimulation and a dual attention and dual awareness opportunities. So horses, we can also install positive resources. So horses can invoke those sense of positive experiences, comfort, trust, safety in relationships, and that helps clients build those internal resources, which then helps when we get to the yucky hard stuff. Horses also encourage clients to notice body sensations in a safer way. So it's an experiential process. So clients can be activated by certain things, and we can unpack that in a safe way with that safe relationship. So there are a whole bunch of different models that practitioners might be offering to their clients based on that client's needs and therapeutic goals. These are just some of them. And I guess what I wanted to point out here was that equine assisted treatment or equine assisted psychotherapy in and of itself isn't a model, but we might offer, equine assisted EMDR, equine assisted play therapy alongside a horse. That's how we're staying within our scope of practice. Right. So what are the benefits? So what I can share with you from my 10 years of experience of doing this is that for those people who are drawn to nature and working alongside horses and animals, it just simply increases their access and willingness to engage in a mental health service. There's a whole bunch of evidence about being outside and being with animals, decreasing stress and anxiety and depression. There's improvements for memory and cognition through physical movement, emotion regulation, cognitive engagement. Horses and being outside in nature provide a multisensory, motivating and calming environment that enhances learning, attention and memory consolidation. So there's also benefits for the therapeutic relationship. So in traditional talk therapy, there's a potential for the clinician to be positioned as the expert, and the horses don't show up as an authority figure. So they offer, and they can offer then that immediate feedback to clients about how they're showing up and giving them that information in a really judgmental and more accessible way. And then the client and therapist are kind of working side by side. So that power imbalance isn't so great because they're kind of working and co-creating sessions together. And the horse is having input into how that's created as well. So it's like a trio of folk as opposed to two, which can be less confronting for clients, I find. And that client also has a lot of agency in their approach, so they can choose how they interact with the horses, if they want to touch the horses or not. And this promotes autonomy and self-efficacy, and there's less dependence then on the therapist kind of driving that process. They also model safe relationships. So the way we approach offering these experiences is that the animals are given choice about how they interact with clients. They aren't forced to engage with people, and they have options to leave and exit if they choose. So this models to clients' safety and healthy boundaries in relationships. And the other thing that happens too is that the clients get to see how the therapist engages with the animals. So we're kind of demonstrating who we are as a person and how kind we are and respectful, and that kind of approach of care towards our co-facilitators. And this then gives the opportunity for the client to see a bit more about us as a person, without having to kind of learn that initially themselves. It kind of happens straight up. They're watching and noticing. The other benefit is that it's really good for us therapists. We're receiving all of those benefits as well. We're outside in nature, we're alongside animals, we're co-regulated. So we get to have all of those benefits as well. So a little bit more about increasing accessibility for clients. So I guess clients have the opportunity to access that safe relationship straight up. So people tend to relate to animals more easily than humans at times, and that felt sense of safety is relatively instant. It's fun and it's novel. Not many people get the opportunity to do therapy outside. Not everyone gets the opportunity to be out on a rural property and out in nature. So that novelty is really cool. And we're doing something new and exciting, and this can create increased engagement in the therapeutic process. Even though some models might, like EMDR is a good example, might have some structured and staged treatment phases, there's still lots of flexibility in how we approach treatment. And part of that is simply the fact that we're outside and we're working alongside the natural world and with animals, and we can't control all of those things. We can't control when it rains or how the horses respond. So we're always co-creating and leaning into that flexibility all the time. There's the opportunity for movement and play, and that's really important for nervous system regulation and engagement, particularly for kids. That play-based option to do things like building an obstacle course with a horse, like it's kind of becomes like a giant sand tray almost, which is very cool. So the other opportunity is safe touch and being held by horses, like literally and metaphorically. So you know, us as therapists, it's difficult to offer that safe touch. We can't always do that in a way that's professionally appropriate. So, but horses can. People can hug horses and touch them and get that opportunity for safe connection. And then mounted experiences might offer someone that physical feeling of literally being held by another safe relational being. The other opportunity is that we can highlight patterns in real time. So again, this is an experiential approach. So people can receive authentic, non-judgmental feedback in real time. It kind of happens instantaneously. And then we can, it highlights those patterns in a really gentle and engaging way. So how do folks become or get involved in this type of work? So first and foremost, the clinician would be a mental health professional. So they would need to have all of their qualifications and experience and registration as part of that requirement, and also be competent in the space of horsemanship. And that doesn't mean that the practitioner has to be, you know, a competitive level riding person. Yeah, that's certainly not what it's about, but there are expectations around professional development and understanding how to facilitate that animal-human interaction. So alongside their professional development requirements as a clinician. They would also need to be doing some extra training around how to facilitate that interaction between humans and animals. Okay. The challenges. So, yeah, having the resources to be able to provide this, so having the space out in nature, the facilities, and having animals, it's all a very costly experience. Wouldn't have it any other way, but yeah, that's the reality. Not everyone has access to horses and paddocks and things like that. For practitioners, which is one of the reasons where nature-based therapies kind of was founded as a concept, and then one of our commitments is about that sense of community, because we realised how isolating the work can be, and I'm sure other nature-based practitioners experience this too, but often those offering equine assisted treatment might be working from their own property or by themselves alongside their horses, so they're not having those general interactions that you might experience in a workplace. So it can be quite isolating. It's really important to connect with other practitioners in the broader community. There's still a lot of bias and resistance out there from funding bodies due to a lack of understanding and some of those other challenges that were created as part of the inconsistencies in terminology, and lack of regulation in the sector. So currently there's no peak body overseeing practitioner competency in this space, and there's no protected titles. And professional development is really reliant on practitioners doing, like, committing to that themselves, and committing to that ongoing improvement, again, because there's lack of regulation. Okay, the fun bit. Well, this is a fun bit for me. This is my gorgeous horse, Lewis. And he and I worked together with this particular client in the context of equine assisted EMDR. So she was referred to me for trauma treatment. We did a short stint of sessions. So her background was that she was 14 years old and she'd recently had an experience of sexual trauma. She also experienced general anxiety. She was autistic, and she had social anxiety and depression as well. And at that time, her mum reached out because she was having thoughts of self-harm. So she, I think she'd met me maybe beforehand, but her engagement with my services was very much based on the fact that it was outside and that there were horses involved. So, and I hear that a lot in my practice, particularly with children, that room-based settings don't float their boat, and they really just enjoy being outside, being able to move. And if they like animals, then don't need to have any experience with horses, but just being drawn to animals definitely helps with accessibility, engagement, and the therapeutic process. So EMDR is a staged treatment process, and it has 8 different phases. So what the first kind of cluster of phases after assessment and treatment planning will be about resourcing. So for this little person, Molly, she really liked being outside in nature. She talked to me about how she would walk her dog, and that was really regulating for her. So we were able to then create some parallel experiences for her with Lewis. And we also were able to practice some of the strategies that we would do when we got to the trauma reprocessing, such as bilateral stimulation. We were able to practice that in a really engaging way. So for her, she really enjoyed grooming, so we were able to practice bilateral stimulation this way. And that also helped with some of the history taking in the beginning and her sharing enough of her story with me that I could then plan the next phase of the treatment. So having him there and having her engaged, and giving her that dual attention of a grooming activity, for example, as we explore her story a bit, was really helpful for the process in the beginning. And that also helped us, her and I, and us as a triad. Is that even a word? Trio, that's what I meant. Triad. Yeah, as a trio, we kind of created that sense of safety together. So, yeah, he also did lots of funny things. Like I remember part of our initial process was creating in the paddock with some materials her expression of the most stressful parts of her life at the moment. And he would do things like come and, chew the cone that she'd use. And that then creates an experience that we can kind of unpack together about what do you think he's doing? What do you think he's saying? If he could say something to you, what would it be? How does that make you feel? So it's all very interactive, and we kind of can lean on that humor, and the fact that she's really interested in horses kind of helped soften any distress that may have come up for her, kind of dipping into some of that harder stuff. So then we moved on to phase 4 of EMDR, which is the desensitization process. And I decided to offer that with a mounted experience. I could have done it a range of other different ways. It was more about engagement in the therapeutic process for me. And I find he can offer me a range of different pieces of feedback about where the clients are with their processing. So, for example, there've been times where, and I'm probably only guessing because I don't know what he's thinking, but, he might stop and do a poo at a pertinent position, and that's a sign of stress and nervous system regulation for horses. So he might yawn, he might do an out breath. They're all signs of nervous system regulation. And for horses, when they connect with humans, there's that neuroception process, and they can be regulating their own nervous system. But if they're picking up on dysregulation in others around them, they'll automatically try and regulate that as well. So I don't know if it was his stuff or her stuff or our stuff altogether, but there was some co-regulation certainly happening in those moments. So yes, I chose to do a mounted experience for her, which involved her sitting on the horse. We use some really basic equipment so that she can feel that rhythmic motion of the horse's walk. That's one form of bilateral stimulation. And he would have, he's wearing at the moment, a halter and a lead, and I'd be walking beside him. So that way I'm tracking and noticing what he's doing and how he's feeling, and also tracking where she's at in her process. So the other part that was really important for her was being outside. So we also then got to, we have a big walking track here, so we get to connect with other parts of nature as we're going around. She also then had the opportunity, while she was processing those memories, to feel held by him, quite literally. He was keeping her safe, taking care of her as we're walking. So, and then the other part to that too is that sometimes I find, because I work with lots of neurodivergent folk, and I find for them sometimes being able to pay attention and maintain and sustain that concentration can be tricky. So offering a mounted experience can, I find in my experience, can help people maintain that present moment awareness, and because they are sitting on a horse and needing to focus on not falling off, but they're also really interested and engaged. So that's engaging the novelty part of the neurodivergent brain in an activity of high interest, but also in a safe way, activating them to stay present by needing to sit on the horse in a certain way. And the horse is moving, so that kind of creates an extra bit of dual awareness and attention. So yes, we processed a bunch of memories, and that was really cool for her. I think we did 3 mounted experiences that helped her decrease the level of distress that came up for her as a result of that experience. So the other part to EMDR is that we would be using bilateral stimulation to strengthen a new positive cognition that came about as a result of that processing. So For us, again, I could use the rhythmic motion of the horse's walk. I can also get clients, if they feel comfortable to not hold on, they can do butterfly taps as well. That's often the case with little kids because they're super confident. They just sit up there and they've got good balance, so they can do both at the same time, and that's really helpful. And then that present moment awareness was really good too. And the other thing that came about was being able to offer her the opportunity to really sense into that felt sense of safety in that moment. So she'd gone through all the hard stuff and come out the other side, and we can do things like body scans and awareness of positive cognitions and that felt sense of safety that was now created as a result of all of those things. So her feedback to me was that it was really helpful to have Lewis there with her. She really enjoyed being outside. She liked being able to move and not have to sit still. She found it enjoyable, like therapy was enjoyable. And she had lots of reminders of her dog along the way. And that's good adaptive information for her because that's one of her resources that she was already using at home. So she was able to check back in with that. Cool. So there are, like, if you're interested in learning more, getting involved in this sort of stuff, feel welcome to contact us at Nature-Based Therapies, and we can kind of steer you in the right direction depending on your training needs. I'm also part of the facilitation crew for an MHPN group called Nature-Based Therapies. So that's a great opportunity, free PD, to network and attend webinars and workshops that are not necessarily around always around equine assisted therapy, but more nature-based therapy. And there's other ways to connect with the community and find out more resources and research through OHA, and the Animal Therapies Limited also have a resource tab on their website. So time for questions.
Thank you, Nadine. Thank you so much. I will stop recording and we can have some questions. Thanks for that overview of equine assisted therapy.
Pleasure.